Hello, everybody. As we finish up our Nurses Week celebration for 2025, I hope you've enjoyed your personal celebrations, your organizational celebrations, in those highlights and spotlights that Creative Healthcare Management has brought to you. I believe that no week or no celebration should end without a call to action. So today I'm just going to take a few minutes to talk about what is the future of nursing and what are those imperatives that we need to do. I'm only addressing some of these that you as an individual can take ownership and address. So when I think about the future of nursing, I think of us as a true profession. In other words, looking at the tenets of professional practice and figuring out what is it I can do as an individual to advance those tenets. So you may be sitting there going, well, I'm not really sure what those tenets are. So I'm going to share with you my tenets of professional practice. And that is having a standardized body of knowledge, really looking at how do we as a profession standardize the entry level education for nursing, and how do we as a profession and you as a professional advance your education. So whether it be you got your diploma, you're going to go on for your baccalaureate, you got your baccalaureate, you want to consider going on for your master's or even higher or even national certification. So that's one tenet. Another tenet would be getting involved in shared decision making, and this is both for at the point of care and leadership. Nursing owns their practice. You as an individual need to own your practice. So if your organization is doing shared decision making, and even if it's not, you need to be A, involved in it, and B, advocate for it. So that's another tenet of professional practice. Every other profession manages and controls their work. Another one is utilizing evidence-based practice. So making sure that you are doing things because the evidence is telling you to do it, not because you, as a 40-year nurse, have always done it this way. I love it, used to love it when the new grads would come in to the hospital and they would say, well, why do we do this? So if you've got people in your organization saying, why do we do this? I really encourage you to pause, sit back and go, I wonder why we do this. Is there another way? Another tenet of professional practice, and one that I believe in strongly, is autonomy and autonomous practice. And the definition that I utilize for autonomy is the ability to make the right decision for the patient in the moment that it matters. Some people think of it as, oh, I'm breaking the rules. Well, it's not breaking the rules. You're making the right decision for the patient in the moment it matters. You know, a very simple example of that is, say you've got visiting hours up until 8 p.m. and my daughter works until 10 p.m. and can't see me during the day. Well, you make the decision at 10 o'clock at night to allow my daughter to come in and visit me because maybe I'm critically ill, etc. That's making the right decision for me. That's what I needed as a patient. It's also what my family needed to make sure that mom was doing okay. And then the another one is the relationship with the patient. I mean, obviously we have to have relationships with the patients, and it's how do you get to know the patient? How do you see them as an individual and not just the gallbladder in room 210? So there are other tenets of professional practice that I just want to highlight on, and not everybody agrees with these, but to me, these are critical for the future of nursing. And that is developing the voice of nursing so that individuals, the public, knows that nursing is not just back rubs and bed baths. Nursing is an intellectual discipline. There's a science and there's the humanity end, but it's the science of nursing we have to make sure that the public understands. Many of you are familiar with the fact that the baccalaureate degree program has been declared by the American College Association the most challenging baccalaureate degree because of the intellectual discipline and the amount of knowledge that goes into it. So we need to make sure that instead of saying things such as, I'm just a nurse, proudly say, I'm a nurse. And this is how I make a difference in patients' lives. So that's one area that I think all of us can take action on today. Another area is the intolerance of horizontal hostility. Unfortunately, the statement, we eat our young, is still out there. I don't like that statement. although we do know, and I do acknowledge that there's horizontal hostility out there, and it shows up a lot of different ways. It could show up in inequitable assignments, isolation of, from breaks of somebody not inviting them to breaks. It could be show up by withholding information. We really need to look at that. And I'm going to share some what I think are staggering statistics with you. 73%, 72, 73, and these are, by the way, from a research study done by the American Association of Critical Care Nurses many years ago. 73% of nurses report that they have been a recipient of horizontal hostility. 73%. Yikes, that's really bad. 55% of nurses say they have been a witness to one nurse treating another one poorly in the last 6 months. I'm not talking about throughout their entire career, but in the last 6 months. So the question is, well, what do we do about it? And that is, we as, I think, individuals, but in particularly nurses and healthcare, need to begin to develop, not even begin, we need to develop an intolerance of horizontal hostility and a comfort with crucial conversations. Here's some more statistics from the American the American Association of Critical Care Nurses. When you think about crucial conversations, it's a conversation you have to have when the stakes are high and potentially the emotions run deep. And the emotions could be fear, it could be anger, it could be sadness, whatever the emotion is. Their statistics in this research study that they did said, and I'm going to be looking down so I can get the numbers right, 62% of RNs take dangerous shortcuts. Yikes. And this is self-reported. 64% of nurses work with people that have trouble following directions or show poor judgment. There's also, by the way, statistics that correlate to this is for physicians as well, but I'm only sharing nursing. 53% work with colleagues unwilling to help or colleagues that complain when asked to help. 53% have concerns about a colleague's competence. And 88% have one or more colleagues who gossip or is part of a team that divides. That's a dividing clique. That's huge. So think about all those, and I'm sure you're thinking in your head, well, yeah, I work with that team. Out of all those statistics, only 20% of those issues have ever been addressed because people are not comfortable with speaking up for fear of retribution. So I want to also share with you, and again, the name of the research study from American Association of Critical Care Nurses was Silence Kills. And they shared an example of a critical care in which there was a particular on-call physician who was not known to be Mr. Kind and Gentle when woken up at 2 o'clock in the morning. So a cadre of nurses working in this ICU felt very uncomfortable calling him because they didn't want to be on that end of horizontal hostility. So when their patients deteriorated, they waited and waited and waited until there was no choice in the matter. They had to call the physician. And unfortunately, they waited to the point of no return for that patient. So those patients had a higher mortality rate than the patients that in which the people that had a comfort with crucial conversations called the physician earlier. So just keep in mind, silence kills. And we've all seen us holding our tongue and not speaking up about a patient. So silence kills, and it's really like, ugh, that's not too great. So my question to you as we wrap up 2025 Nurses Week, honor of Florence's birthday and everything she's done for us, what will you commit to today? Not next week, not next month, not next year, but today. What will you commit to advance our profession?